Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim Mustafa. This is Jamia TV. We are on Health is Wealth. And today we are still talking about Clubfoot. Last week we engaged Dr. Nancy, a physiotherapist working in Nairobi, and she highlighted a lot of things on Clubfoot. So today I'm joined by another doctor. Let me introduce him as a doctor, because he is a clinical officer. So Dr. Eric Mwangi, who is currently working with Clubfoot Kenya. What is Clubfoot Kenya doing? What impact is it putting to our society? What are they really doing to impact us? So Eric, karibu sana. Mimi niko hapa na nilikuwa na kungoja sana. At least now we engage you, because last time we talked about Clubfoot. Yeah. We knew what a Clubfoot mean. But before I get into that, watazamaji wanashangaa, Eric, vipi bana? Now tell us about yourself and what you do with Clubfoot.
Thank you very much, Mr. Kasim. Yeah. My name is Eric Mwangi. Yeah. I am a clinical officer by training. Yeah. I work with Clubfoot Care for Kenya.
Yes.
Clubfoot Care for Kenya is an NGO.
Yes.
And it's a charitable organization, a non-for-profit one.
Yes.
That works with public hospitals, faith-based hospitals,
yes,
and also other national NGOs.
Yes.
Our aim is to treat children born with Clubfoot.
Okay.
And we are there to alleviate the burden that comes with disability caused by Clubfoot.
Yes.
Because Clubfoot can be treated.
Yes.
Yeah. So in Clubfoot Care for Kenya, I am the clinical program coordinator. I coordinate clinical services.
Yes.
So Clubfoot Care for Kenya takes a holistic approach to help children born with the Clubfoot deformity.
Yes.
And holistic approach, I mean, we have two aspects. You know, the mother will bring the child to the hospital.
Yes.
And the child will be taken care of because they have the Clubfoot disability.
Yeah.
But who takes care of the mother? You know, wakati mwingine hata mtoto hajui akona Clubfoot, alizaliwa na ulemavu wa Clubfoot.
Yeah.
Kwa hivyo sasa, kwa Clubfoot Care for Kenya, we have two dockets. Yeah. One is for counseling, another one is for treatment.
Yes.
Yeah, so for the treatment, we partner with hospitals.
Yes.
Right now, we are partnering with 30 facilities all around Kenya.
Okay.
And they are spread across 23 counties in Kenya. Yeah, so basically, I help the clinicians that are treating Clubfoot. By clinician, I mean rehab clinicians. Yes. Physios, occupational therapists, orthopedic technologists, orthopedic and trauma. We also have doctors that perform tenotomies, clinical officers. It goes as far as the surgeon. So the clinical part is all about capacity building and making sure that the services that is offered, the Clubfoot service that is offered, is up to the standards that we normally use.
I wanted to ask, you are rich as Clubfoot Care for Kenya. Then you told me your reach is up to 23 counties in the country. Maybe you help us understand the most areas that are affected by Clubfoot.
Yeah.
Of course, there are always that counties, there is that place. Na, of course, pia kuna factors. So sijui kama kuna areas zingine unaweza kupata watu wanapata malaria kwa sababu the environment, kuna umbu nyingi, kuna areas watu wanapata homa kwa sababu hiyo area iko na vumbi mingi. So now we talk about Clubfoot. Which county is having the highest number of these recordings of Clubfoot? Then as we move on.
Yeah, that's a good question, and we normally get that a lot.
Yes.
And from our experience, you know, Clubfoot, 80% of children born with Clubfoot, they normally have a Clubfoot we call idiopathic Clubfoot. Okay. Idiopathic inamaanisha the cause of the Clubfoot cannot be clearly stated.
Okay.
Inaweza kukosa kujulikana the problem.
And
in the 80% of children born with idiopathic clubfoot, 90% ni kwa clubfoot ni watu ambao wanatoka kwa low and middle income countries.
Okay.
Yeah, and this quite makes it difficult to say that a specific region has a lot of people affected with clubfoot.
Yes.
The only thing that we currently use when mapping zile clinics, kwa sababu unajua ukifanya nini unataka to reach to the maximum number of people that you can.
Yes.
So we normally use the population, the census that was conducted. And it's noted that in places with high population, you are likely to find more cases of clubfoot.
Yes.
So you find like in Nairobi we have 4 clinics, and we see a lot of children born with clubfoot. And then in the western region we also have a higher population. So in those regions you will find that we have a lot of
high rate of
high rate of clubfoot. So mostly what we can say right now is population plays a very big factor, especially when it comes to clubfoot. So areas with higher populations and higher birth rate, then the clubfoot is kind of high.
Okay.
Yeah.
Now, as I'm still on, we haven't even started talking about clubfoot in the facilities, but because whatever role that you're playing is to ensure that you reach those people who are having clubfoot within the society. Tell us more about care, Clubfoot Care for Kenya. Are you doing this for free or you have the charges?
Okay. Yeah, we work with the county governments and also the national governments. So everywhere we establish a clubfoot clinic, we normally develop what we call an MOU. So an MOU is an agreement between Clubfoot Care for Kenya and the facility. Yeah. So what happens is that the facility itself, of course, come up with their own things that they would want taken care in the MOU. And what Clubfoot Care for Kenya does is that it provides treatment materials. I believe that we know that plaster is normally used in clubfoot management. The casting. So Clubfoot Care for Kenya provides the casting, and it also provides the specialized shoes, the braces, and it also trains the staff of the facility. And then Clubfoot Care for Kenya also provides a person called parent advisor, a person who counsels patients. They help with follow-up of treatment by calling them, reminding them of the treatment appointments, and all that to take care of the social aspect of this child. And on the other hand, the hospital will provide the staff and then the space for treatment of clubfoot. So it's more of a partnership. So in most of our facilities, clubfoot is offered free of charge. The only thing that might probably require to be paid is the administration fee. Wakati mwingine mzazi anaweza kuja afungue a file with like a 300, and then also that is the service fee that normally will be used to take care of the facility.
Wow, mashallah. What was the idea behind coming up with this initiative?
Yeah, so the idea was looking at clubfoot. Initially, clubfoot was being treated surgically. So every child born with clubfoot would undergo a knife so that they could achieve
fix the leg,
achieve full correction. But the founder of Clubfoot is called Dr. Theuri. So he went to Uganda. He was doing a dissertation there, and he realized that he's an orthopedic surgeon. He realized that in Uganda there are not a lot of clubfoot cases in the theater. So he tried to find out what is happening. Why aren't we having a lot of cases, surgical cases in theater? Kenya. So he realized that there is this method they use, the Ponseti method. And now he transferred that to Kenya when he came back to complete his studies. So he brought that to Kenya. And it was noted that clubfoot can be corrected very simply.
Easily, yeah.
Yeah, so you know, for surgery, for a person to be, for a child to be corrected of clubfoot, they undergo a lot of surgeries. It's not only one surgery.
Yes.
Surgery to try and align the bones,
Yes.
lengthen the tendons,
Yeah.
sometimes remove the muscles and put them somewhere else so that the forces can still act well.
Yeah.
So he realized that this is something that can be done even in a few days,
Yes.
and the foot is fully corrected.
Yeah.
And this will save this child the burden of going through surgery, and then also the relapse will be quite high for surgery.
You tell us about this facility. How long have it been in existence?
Okay, yeah. Clubfoot Care for Kenya has been in existence since 2008.
Okay.
Yeah, it started as a program in a hospital called Cure International.
Okay. Yeah.
And then in 2018, it grew out of Cure International, and it was registered as an NGO.
Yes.
So we were actually celebrating 20 years in 2025 of November.
Wow, mashallah.
Yeah, so right now we are around 26 years.
So you've been serving for 26 years.
Yeah, Clubfoot Care for Kenya.
Clubfoot Care for Kenya.
Yeah, but I've been working for Clubfoot Care for Kenya right now for closely 4 years and some 6 months.
This is a good time, man.
Yeah.
Good job that you're doing to impact the society positively. Now we get into the topic now, even though we might only answer 2 questions.
Yeah.
Because I was checking on my time and I'm like, guy, why is time running so fast when we haven't even started the topic?
Yeah,
but now we have to understand Clubfoot. Last time we talked about the root cause of Clubfoot. We talked about the risk factors of Clubfoot. But now, because we've already highlighted them in the past, but our viewers, you know, some of our viewers were not there. Today you watch TV, tomorrow you don't watch TV. So maybe you start by helping us understand some of the risk factors of Clubfoot as we move.
Yeah, so as I said earlier, Clubfoot can be, I would like to divide it into 2.
Yes.
So we have the idiopathic that I was talking about.
Yes, you talked about it.
Yeah, 80% of children born with Clubfoot have idiopathic Clubfoot. And this is Clubfoot that we cannot attribute to anything.
Yes.
Then we have around 8% of Clubfoot. Children born with Clubfoot, sometimes they have it has a genetic predisposition. So you'll find that if a father had Clubfoot or a mother had Clubfoot, they are likely to have a child born with Clubfoot.
Okay, so it is hereditary.
Exactly.
Okay.
It can be hereditary. And then we have another percentage of Clubfoot that is called syndromic or secondary Clubfoot.
Okay.
So the secondary Clubfoot is Clubfoot that appears with other conditions.
Yes.
You might find like deficiency of folic acid might cause a child be born with a condition called spina bifida. Ile tunaita mgongo inakuwa iko na kidonda.
Okay. Imefura.
Imefura. Sometimes it can be open. Inaweza kukua hiyo kufura imefunguka ama ni kidonda tu unaona ni kidonda. So that one might make the child be born with a Clubfoot.
Okay.
Yeah, so hiyo inaitwa secondary kwa sababu Clubfoot haiyuko inakuja as a result of the spina bifida, the condition. Yeah, and then so basically that is secondary type of Clubfoot, and it amounts to around 8 to 10% of Clubfoot cases.
Oh,
yeah.
Nice. Sasa mtu ameniuliza swali ambayo ni very important. Umeongelea kuhusu folic acid. How is it important for parents, guardians, like not guardians actually, I'm talking about a mother, kupewa folic acid? What is folic acid and what is the role of folic acid?
Yeah, so folic acid is something recommended to people of reproductive age. So it doesn't mean that if you want to get pregnant, you start taking folic acid. It's something that you start even before.
Okay.
Yeah, you find in developed countries, kuna something called fortification,
yes,
whereby folic acid is added to something like unga ya ugali. Iko na some amount of folic acid because they realize that it's very vital for preconception care. Kwa hivyo folic acid, as much as somebody or a lady is above 15 years, that is the age that they can be able to conceive, it's good they start supplementing for folic acid because it is required in kitu tunaita organogenesis. Wakati a person conceives, they get pregnant. The first 3 months is where organogenesis inachukua place.
yes,
Na wakati huo, a lot of folic acid is used from the mother. You know, what the mother eats is what makes the baby.
yes.
So that's where you find low folic acid will cause issues with formation of the spine, kwa sababu wakati spine ya mtoto ina form,
Yes.
kuna kuanga na consumption of a lot of folic acid.
Yes.
So folic acid is something that plays a vital role in organogenesis and formation ya of the parts of the body in vitro, akiwa upande wa in the womb.
Okay.
Yeah, so it's something that should be supplemented, not when you're planning to probably get a child or conceive, even before you start planning on conception.
Okay.
Yeah.
Time imetukimbilia. Nataka kumaliza hii show.
Yeah.
Nataka tuimalize in a way that wale watazamaji wa nyumbani kwanza watajua facilities ambazo ziko karibu na wao. You did mention about 23 counties. That means you have a memorandum of agreement of understanding with about 23 counties.
Exactly.
So if you have the memorandum of understanding with 23 counties, someone is watching from Malindi, how can they get the facility when they have children with such illness? We say disability that can be reversed, yani inaweza rekebishwa. So someone is watching again from Kisumu, they want to understand exactly the facility to visit. So maybe you help us know these facilities, where, alafu you tell us, are you now still going to be in those counties, ama mnapanga ku reach out, because we still have 27 over 20 left. Yes. Over 24 counties. Yes.
Yeah. First of all, ningependa kusema, I think it will be good if I probably give a phone number that a person can reach out to find out if to find out the nearest clinic.
Yes.
So it's 0787 370 421. So if you
repeat it again,
07 87 370 421. Yeah, and then we are also on Facebook. We are called Clubfoot Care for Kenya.
Yes.
Clubfoot Care for Kenya. So if you search Clubfoot Care for Kenya, you will see all those cases of clubfoot that we treat. Now to the counties that we are in.
Yes.
In Nairobi, we have 4 facilities.
Yes.
We have Mama Lucy, Pumwani,
Mama Margaret, Kenyatta.
Not Mama Margaret. Mama Margaret, we had an agreement there, but we moved to Kenyatta now.
KNH, okay.
Yeah, KNH. And then a facility called APDK Nairobi, Association of People with Physical Disabilities.
Okay.
Yeah, and then in the central, we are in Moranga County Referral Hospital, Nyeri County Referral Hospital, Embu County Referral Hospital in the eastern. Then we also are in Meru County Referral Hospital.
Okay.
Then in the coast region, we are in Taita Taveta. It's called Moi County Referral Hospital. And then we are in Mombasa, we are in APDK Mombasa. It's in Portrees.
Okay.
Then in Kilifi, we have 2 clinics. We have Kilifi County Referral and Malindi Sub-County Hospital. Yeah, in South Rift, We have Kericho County Referral Hospital, Kisumu County Referral Hospital, Siaya County Referral Hospital. We have Kindu Adventist Hospital in Homa Bay County, and we also have Kisii County Referral Hospital.
Okay.
Then we also extend to as far as Migori.
Okay.
And then in the North Rift, we have MTRH, Moi Teaching and Referral Hospital. That's a national referral hospital. We are also in Kitale, Bungoma.
That is where I was waiting to hear.
Yeah.
Okay.
Yeah, in Kitale. And we are also in Bungoma County Referral Hospital. And we are in Kakamega County Referral Hospital.
Okay.
Yeah, those are the 30 facilities.
Thank you so much, Mr. Eric. That was really a good idea, good initiative. And now that we are just here to impact the society, ladies and gentlemen, we are here only to help you understand your health. We are only here to help you learn more about your health. And that is why we are even trying our level best to bring you the facilities that are close to you that can help you. Imagine going to a hospital, getting treated for free. Who does that? So today, we got that chance to know these facilities in Western Kenya. He talked about Kitale, he talked about Kakamega, he talked about Bungoma. He also talked about Meru, Kisumu, Taita Taveta, Murang'a, Nairobi. Very many facilities are here, ladies and gentlemen, to help you and your child get back to normal. If you have a child having clubfoot, we said unapata mtoto miguu imepinda, si ndio? Unaweza shangaa tunazungumzia terminologies ambazo ni ngumu, lakini tumesema mtoto anazaliwa miguu imejipinda, either imeangalia nje ama imeangalia ndani. These people, the Clubfoot Care for Kenya, are trying to help you, are trying to elevate this serious issue within our society. Bwana Eric, maybe you might be having a message to our parents home before.
Yeah, thank you very much. So my message to parents, caregivers, would like to first speak with mothers that clubfoot is treatable, and not only clubfoot, any pediatric condition that can cause disability.
Yeah.
There is something that can be done.
Yes.
And help is just out there. Don't hide your children. Please take them to the nearest health facility. At least you will get some information on what can be done and what can be done to alleviate any form of disability. Yeah. To fathers, please, clubfoot is not a curse. It's not something that comes about because of something that the mother did. Yeah. It is something that just comes, and as we've discussed the factors, please be supportive to these mothers. Go to clinic together with them, give them the support that they need, because there is the burden that comes with disability. And to doctors that are treating clubfoot, thank you very much for the good work that you are doing in the facility and the commitment to making sure that we eradicate disabilities caused by clubfoot. And to Clubfoot Care for Kenya, continue doing the good work that you are doing in the facilities, and may God bless you.
Thank you so much, Bwana Eric. Time is really not on our side. I wish we could talk about very many things, because of course you as a facility, you as an organization, you are having your own challenges. Very many. You encounter them, and I heard Daktari the other day saying that most of these facilities, you go to a facility, mzazi anakuambia, baba anasema no, kwetu bana kunanga mambo kama haya, wewe umekuja nayo. So it is also one of the challenges, but I'll still create time. We talk more about this, because of course we haven't talked about what you do. You do surgery, we call it tenotomy, yes. You do the surgery, but we didn't talk about surgery, but inshallah in future or in the next episodes we'll highlight them. We at least know about what tenotomy exactly mean, how tenotomy is done, and all the procedures about it, inshallah. Thank you so much to our viewers back at home. Ladies and gentlemen, I want to end it here. But to our parents, you've been told that don't take this as a curse. Allah creates, Allah destines, and whatever that is destined to be on your side will and shall always come. So be very careful, be thankful, and always look for medical attention. Seek medical attention as fast as you realize there is a problem with your child. There is those parents who give birth at home. Please try to check your child very well, because this clubfoot can be corrected in 5 years. Your child will be very okay. But now, how is it corrected? We've already highlighted it. Mtoto wako ukigundua kwamba wiki moja, wiki mbili mtoto wako mguu wake haiko sawa, tafadhali tembelea vituo vya afya ambavyo vimetajwa pale, na inshallah najua siku zijazo Clubfoot Care for Kenya watakuwa wanafika maeneo mbalimbali ili tuweze kuona kwamba watoto wetu ambao labda wanazaliwa na hali hizi za afya ambazo si za kawaida lakini zinaweza rekebishwa, wanawafikia inshallah. Kwa hivyo mtazamaji, hadi kufikia hapo, this show huwa haijulikani, naongea Kiswahili, naongea Kizungu, but don't you worry. It is here to help you understand exactly what we are talking about. Angalau wewe utuelewe na sisi pia tukuelewe. Tumie ujumbe kupitia nambari zetu za simu za WhatsApp, na pia muda ukituruhusu tutaweza kufungua line zetu za simu siku zijazo inshallah mtazamaji, ili uweze kutuuliza maswali mengi zaidi. Hadi wakati mwingine, mimi ni Kasim Mustafa. Assalamu alaikum wa rahmatullahi wa barakatuh.